on actually all of this.
Yeah.
So.
Yeah, well, 7:27. Let's get Dr. Hoa Nguyen of the American Medical Center onto the show this morning. Good morning, Doc.
Hey, good morning, guys.
Good morning.
So just real quick, we catch up. Can you just give us your interpretation of the last few batches of testing we've done? But first, I kind of want to start with, we've seen in these press conferences, the governor and her team continually talk about how we are expanding our testing capacity. And yesterday we tested just 12 people for COVID-19. So how does that add up? I know you're on the Physicians Advisory Group, so we kind of wanted to get your take on that, Doc.
Okay. Yeah, we are expanding our testing capability, but right now we have, I know GRMC have their machine almost running. They promised by next week. DOS also probably sometime next week. So that's the ramping up the testing the capability. And we just received from FEMA two Abbott rapid test, which is the very, very nice test. It takes 2-3 minutes. And so one is currently situated at GMH and the other one at Public Health. And we're planning to move that to GMC in the near future. We have the device, but they only send out along with that 200 kits for the two devices. So again, is the number of tests that we can run, but we are, I think, getting in more kits to run on those Abbott devices. At GMH and will be at GMC, but shortly. That's what the information we have from last night. So once we have GRMC on board, DOS on board, Public Health, and along the two machines, you can do a lot of tests every day, probably in the ability of 100 to 300 a day at least, or more. But right now, like I said, the machine is here, and they're working hard to get everything in. It's just the machine itself, guy. It's the media, all types of chemical, everything to make it run. So they are working on it. And by next week, you should have a different picture now.
Right. And, like we mentioned, there were only 12 tests that were run at Public Health. Prior to that, without having the Abbott machine over at GMH or GRMC, they were running an estimated 40 tests a day. And so I'm just kind of curious, why did we stop doing 40?
Yeah, there's like I say, there's a lot more involved in just testing right now. I know the VPM, the transmedia that we use to swab people's nose, are in shortage also.
Okay.
So so those are coming in, in the very near future. So you don't have the VPM to swab people. It's kind of hard to run the test when you don't have the transmedia.
So the answer is that we are in short of supplies and test kits.
Yeah, I know we're in short everywhere. Not just Guam. So we are trying to get those things in, especially this Abbott device here. It's really we're going to try to order a lot more. Unfortunately, those devices can only purchase through the lab or through the government. No private entity can order those. And they only ship it within the United States continental, not to territory. So I know the speaker and everyone is trying to change that. So we can get more device to Guam.
Right. And I really appreciate the transparency, because a lot of the times we get these press releases and it's like, yeah, this is all we did.
Yeah,
okay,
no explanation.
So that's why it's kind of frustrating.
And now we don't got to waste one of our two questions at the press conference. So thank you, Doc.
Yeah, that's a key here. I mean, they are ramping up. I mean, they look at every which way. But we just like anywhere in the United States, even New York, they are in shortage of supply. So but a lot of entities here, like I say, GMC, DOS, and Public Health, they are stepping up, and they can only get what they can get.
Right. But GMH, they ran tests through this Abbott machine the day before yesterday.
They did.
So they just don't have the test kits to continue running them?
We have, like I say, they have 200 out of the 2 machines, and that's all that they have right now. So I know they run upward of 50, 60 already. When public health are using those Abbott device to run the kit. Yesterday they're not running the other kit because they short supply.
Okay. So just to recap, Abbott machines are GMH. They're moving the one from public health over to GRMC. Then GRMC also has a gene expert as well as public health, but they're going to move the gene expert from GRMC to public health.
But for right now, just because the gene expert is not up yet, it's not. It just sit there at public health.
Mm-hmm.
So at GRMC, they see a lot more patients walk in the emergency room.
Mm-hmm.
So temporarily, it makes more sense to run more tests at the emergency room. They open 24 hours a day.
Right.
Yeah,
that was the point that Dr. Cabrera made yesterday.
Right.
So
temporarily, they're going to move the machine over until gene expert is up, and then they move back to public health. So
the Abbott.
The Abbott,
Oh.
because right now we try to use as much as possible,
Mm-hmm.
and it doesn't make sense to sit there and run during the working hours and not run 24 hours a day.
Yes. Right.
So, we're going to try to move it to GRMC temporarily at this point.
Okay.
Right on.
Okay?
When do you foresee us ramping up everything?
Everyone says in mid next week. Like I say, it's all about the timeline, the shipping are coming in.
Mm-hmm.
Their machine is ready.
Mm-hmm.
It's just now to get everything else to come in for the machine to run. So it's ready. It sits there until the supply come in. They start running it.
Yeah, I know. We've been waiting for those 4,000 or so test kits for the gene expert, I think, because Linda's been talking about this for 2 weeks. So that takes a while.
I understand that they all fully ready. They just need those supply to come in, and they are waiting. They've been doing a little bit of test here, a little bit of test there to calibrate it, so it's ready.
Mm-hmm. Doc, there's a question here on our Facebook stream about the recovered patients, and is there any are they retested, or it's like you do the what the CDC says? Okay, well they haven't shown signs or symptoms for X amount of days, so they're good.
No, we have. I think they only retest one, but I don't think they retest all the positive COVID yet. There's a lot of talk about this rapid kit test from Saipan, and we tried to beat up our head yesterday on how to implement this thing. You cannot just buy them and just run them insensibly. You have to do it responsibly. So. And the unfortunate thing about it is that we cannot find any one of those things on the FDA list of approval, and right now it's not approval. So if you start using it, you're going to lose some federal funds. So we try to be somewhat creative on using this thing. We're going to try to get approved this morning to use to kind of do some studies on certain groups. I think public health will release this information for everyone that, they break it down certain ethnicity, like the Micronesian, the Chamorro, the Filipino. So we kind of know what percentage and where they're coming from. So we're going to go out and try to use this kit and do some study for like cluster, like close contact, those positive, the symptomatic, those are asymptomatic, and try to get a better picture using those kits as a study, not as anything else.
For like diagnosis.
Right.
It's more for surveillance.
Yes, and try to narrow it down how widespread it is out there in the community. So we're going to try to get approval from working with, from the government, working with UOG and everyone else to try to make this as a study rather than diagnosing anything else. So they are here on an island, so we're going to try to make the best out of it.
You're talking about the Solgent representatives are here on island?
Yeah, I'm not sure which kit they have. I know
the Solgent are the rapid South Korean test kits.
Are these the same ones that the NMI has, Doc?
I'm not quite sure. MD wholesale and certain wholesale don't have them.
Mm.
They are in the possession of custom at this point. We're going to try to use those as a study, like I say. I mean, we know what subgroup it is it belongs to, and it's interesting to know. Um, the Micronesian is very little, only two. The question is, why only two? So maybe the travel is not there, and so we're going to try to do some contact and see if we can kind of figure out well who's out there, the carrier, and who's out there is asymptomatic, but they have the virus. So like I say, this is a study, guy. Is nothing else
Right.
that we do is done
Yeah.
by the government.
So it's not a dead issue.
No, it's not a that issue. We try to use as much as we can. I mean, there's we cannot just really sit there and waste those things and get criticized. So we're going to try to be, like I say, creative and do some study out of it.
So a wholesaler brought these test kits in from South Korea. They were confiscated by customs, and now the government's going to use them for surveillance purposes?
Yeah, I mean, we're going to try to.
Did I
get
interpret
someone
that
to pay
correctly?
for it. Yeah, but the reason is, Sabrina, a lot of people are trying to use this kit, and the most dangerous part is that, they have a false negative. So, I don't want to test someone, a patient, and say, oh, you're negative. They have to sign a consent form, understand that negative doesn't mean anything, because you don't want to use this kit as return to work things
Right.
and return a person to work and infect the whole place. So the reason that it comes to number one is not FDA approved. Number two is that they have to have certain criteria very strict out there for the physician or provider to use. Because we understand that there's some false negative out there that can impact and make this virus revamp again.
But
So
Doc,
how many, I'm just curious, how many of these test kits do you have that were confiscated?
I think the number is from multiple sources, around 3,000.
3,000 confiscated test kits from
Yeah.
South Korea
Yeah.
that are
Well,
not
that's
FDA
what-
approved that we're going to use for surveillance.
Yeah, it's not like, well, like I say, it's for study, okay?
Yeah.
So
Surveillance isn't considered
yeah.
study?
Yeah, it's a study, but we have to be, like I say, work along with UOG, but they're going to bring the paper, so that way we can prove that it's work, and also work with public health to try to, do some PCR testing that to validate, those test kits also.
Are there any other medical supplies or equipment or anything that has come in that was confiscated by Guam Customs in quarantine that the government is now going to use?
No, I tell you, I mean, I'm not sure that I know the letter that come out into the North Sea is a little bit confused, but that's not a purpose of the government to confiscate anything from any clinic, anything like that.
Right.
They mainly need to know what's on island.
Yes.
Okay, I mean, come
Thank
on,
you.
we have to know what's on island because
Yeah.
at this time everybody buy everything out the book, and you have no accountability. Just like how many car you have on island, what type of car you have on island. So you have to know what's on island,
Right.
in case if we shorted somewhere or someone uses something they're not supposed to use.
Right. And then
We're
also,
responsible
Doc,
for that.
Doc, wasn't there also a concern that people are bringing in things that might be making false claims, or I mean, we saw this in dengue where they were seizing stuff that repellents that didn't fall and meet the EPA guidelines. It's kind of a different issue now, but is that also happening where they're maybe seizing stuff that makes claims that aren't validated?
Yes, Chris. That's the part where it's so important to know what's fake and not fake. And so the government have to be aware of what's coming to the island. People buy things from China, from everywhere that they can find from eBay, from Amazon. So those things is that real? Does it hurt other people? Or people will say, hey, this kid is good for you. Test at home. And if I'm the patient, I'm a person, I say, okay, I'm going to buy it from you. I mean, those are detrimental to what we try to do right now is contain the virus. So that letter is not mean so that they're going to confiscate everything out of the clinic and use for the government. Come on, that's ridiculous. Don't think of that way. So they are trying to control what's true and not true and for people to use things responsibly. Okay?
Right. Doc, I wanted to ask you this, something we picked up nationally from New York. The national death toll from the coronavirus has risen sharply, now up to around 31,000. And that's partly because New York City is now counting deaths of people who had COVID symptoms but died before they could be tested. Is this something that we are looking at on Guam, Doc, or is this any part of this applicable to our island?
As you see the spread out, the number they come out and for public they have to release is that you have some COVID, clinical COVID, right? I mean that those guys test negative even to the PCR, but they have all the symptoms and the X-ray, the CT show that they have COVID-19. So even those FDA-approved kits that we run, some of them turn negative, but they clinically COVID-19 positive. Okay, so yes, we are counting the people that pass away for any reason, and some people that have negative tests that is clinically positive. So we are counting those things. We even if you pass away for any reason, they're going to try to test to make sure that they're not COVID related.
And so, Doc, when we do that, if we get, because what you're saying, I just go with this clinical diagnosis thing. So basically what you're saying is that we can get a false negative out of the test that we're currently using right now?
Yes, we are. We see some case that, it doesn't make any sense. When the chest X-ray, the CT is just classic of COVID-19, but they turn negative and they act like COVID-19.
Right.
But the test is negative.
Okay,
and
so
it's not one, it's multiple.
So let me ask, if we have people who pass away and we suspect that they're PUIs or they otherwise need to be tested, if we test them and then we get a negative, how do we have any faith in that test result? And then if it is a false negative, do we then count those deaths towards our COVID-19 casualty count?
You never get anything 100% in any test. You just have to make an educated guess, and then if you do think it is, then you have to do the tracing, the contact, and all that kind of stuff for all the people around that person.
So let me ask you, Doc, that being said, do you think that more than 5 people have died of COVID-19 on Guam?
We have 5 confirmed deaths in Guam. And I'm not sure if they truly die from COVID alone, because all those 5 people have multiple comorbidity, and so even if they come in without COVID-19, there's a risk that they pass away also, and also that those people make the decision that they don't want to be interfered regarding like DNI, DNR. So without intubation and get these people on the machine, it's impossible for anyone to stay alive if they don't have that chance.
So what was the answer there, Doc? Do you think we have more than 5, COVID casualties? I understand what you're saying.
There's a possibility there, Chris, that there's more than people die out there from COVID-19 that we don't know.
Okay, I guess that's something that we're going to have to track down.
Yeah, but is that a lot? No, I don't think it's a lot, Chris. I mean, there's probably less than a handful, and like I say, the most important for those people is for you to identify and trace the contact, so that way we can isolate and quarantine people at home.
Okay, Doc. Yeah, we saw in New York that that was a thing, for lack of a better term, and we wanted to see what the deal was here on Guam. So definitely appreciate.
Yeah, but every day is new, right? What I tell you now, the next day is totally different. So so what I tell today is really just today, and we learn every day that this thing is different. So it's a big thing. And I just want to tell the public that we met with Mr. Ed Byrne, also from Department of Administration, they're going to try to work with the Department of Labor just to try to come up with a certain plan for the people, for our worker employee out there that lose the insurance in the next few months. You know, because that's going to be very important. That's another wave of non-COVID patients that will hit the hospital. So they're going to give us an answer sometime next week.
Okay, Doc, I know you're busy. Want to thank you for your time. Always very, very valuable to speak with Dr. Hoa from American Medical Center.
Okay,
Thanks.
have a good day.
You have a great day,
Be
Doc.
safe.
Wash your hands. Hey, and I got to ask you.
You going on your boat?
Yeah, did you catch anything on Easter? Because you told us you were going to go on your boat.
Yes, I am. I was. I was on my boat, but the fish also in the quarantine. I only catch one.
They're in isolation, Doc.
Oh, goodness.
Thank you, Doc.
Thank you, guys.
Okay.
Bye-bye.
All right. Okay. There you go. Wow. Hey, watch and share the show. We are just dropping some bombs this morning. We've got that village breakdown we were able to obtain. And again, it's just in the spirit of transparency. That information we've all been wondering, and definitely felt that was something that the public, as well as the mayors and their staff, needed to know.